Hi, I'm Tom Delonzo Baker, the founder of Total Motion Release Seminars, and now the founder of the TMR training system that is used in the clinic to train patients a step at a time, and then also can be rented by them to be taken home and used. So a lot of people ask, well, what is the Total Motion Release training system? And I want to give a very brief synopsis of what it looks like. All right, and because in what we have set it up in to look like a school system from preschool all the way up to college level. And each grade is done by the patient with the supervising and the coaching of the therapist, which means you don't have to be hovering and right on top of them. You can actually see multiple patients at once and have very, very high quality care. In fact, over the last 2 years, our first visit improvement average is 40%. And our average improvement for those who complete, not satisfaction, they're incredibly satisfied too, but their average improvement is 90% for those who complete. Okay, with that said, here's what it's set up like. We try to make them get through 8 grades, kind of like this. If you can get through 8th grade, you're pretty much on your own, you can pretty much function in life. The same kind of thing. If they can get through 8th grade, they'll have a technique and a skill that they can use on about 80% of their issues, all right, and aches and pains that they'll have throughout their lifetime. If they get higher up in the system, great. They'll learn how to take care of more of them. They'll learn how to do them quicker. But here's what these grades look like. First one's preschool. It's just the TMR concept. So you've been watching videos probably by now, and you know that we begin our treatment starting on the non-injured areas, or typically the opposite side. So if a person can't move their right arm upward, we're going to move their left one. And we're going to let them experience that. We're going to have them go around and find a bunch of motions that they have that are out of symmetry. It doesn't always have to be pain, but things are out of symmetry when they move left side versus right side. And they're just going to play around and see that, oh my gosh, this concept works, and it works quickly. So we're going to get them experience doing it. Think about a preschool. We don't give them a bunch of homework, right? We don't give them papers to fill out. We want them to play, and that's what we want. We want them to play and experiment. Kindergarten gets a little bit more serious. We have a little form for them to fill out so that they can track what is happening as they're doing the concept. Grade 1, we go into what we call the 6 core exercises. The ones that, when somebody has something going on, check these 6. They can be used as a functional screen. It can also be used as a pain screen, strength screen, range of motion screen. All right, but it gives a big global picture of what's happening in the body. Now, those 6 exercises are the power areas of the body. They deal with the shoulders, the spine, the hips, the knees, and the ankles. Yet, by doing them in the way in which we do them, it also deals with the hands and the elbows and the neck and the jaw. All right? But those ones realigned, and that's what we're looking throughout this whole thing, is where, when they move, are they out of symmetry, left side versus right side? That's grade 1. Now what grade 2 does, it then takes those 6 motions and it adds all 3 dimensions that a person can go through. So what I mean by that is, we may show them the arm raise forward all the way up. Well, there's 5 other degrees of motion. They could go backwards, they could go out to the side, they could go side across, either in the front or the back, and they could rotate. Sorry, you can't see that, but I'm down at my side rotating and rotating. All right, we're going to take all 6 of those motions and show them how to do that. Some of them only have 4 motions, some of them have 6. But we're going to show them all in those dimensions, okay? Directions of the dimension. In grade 3, what we do is instead of doing a straight arm, we do bent extremities. All right? And from there, not all of them are bent. We have our favorite ones that we save for grade 2, and then our other ones that we use less often, but still quite a bit for grade 3. Now what those do is that person, by the time they're done with grade 3, have a significant amount of relief, and they have a significant amount of education on how to help themselves. On grade 4, now we show them why in the world does pain come back, how does it come back, and what can you do about it? And again, all through experimentations. Grade 5 then goes into taking them into what we call 2 dimensions, which we're going to rotate them in. Grade 6, we may rotate them out. Grade 7, we're going to rotate them in with their elbow bent or their extremity bent. Then in grade 8, rotate it out with their extremities bent. Again, this is all done in standing or sitting. When they get past that grade right there, they've now done it in standing and sitting. Everything functional they could think of, right? They now know when they move certain ways, why it hurts, when it hurts, and how to relieve them. And most of the people at that point in time are significantly better, if not pretty much well on their way to needing to be discharged or wanting to be discharged, or saying this is great and I'm done, or hey, this is so cool, let's go to grade 9. Grade 10, 11, 12, 13, and 14 is what we have right now. We'll have up to level 23 here soon. All right. Now after that, grade 9 then starts taking them into different body positions. Standing, sitting we've done. It's going to be on all fours. On your knees, on all fours. Belly, back, and side lying. This is when things really start getting fun. This is when your stroke therapist, your pediatric therapist, those of you who are in different settings, we try an outpatient, begin to connect, really connect to the idea, oh, that's how it works on everybody, no matter whether they're crawling, walking, limping along, okay? It can be used. And you guys as therapists are also going to realize, oh my gosh, your testing and your assessments change. I mean, in other words, what you think, oh, there's a rotation there, and here's a problem here, and hey, I can't lift my arm up when I stand right on the right side, but oh my gosh, when I'm on all fours, it's the left side. You're going to begin seeing things you're going to say, I never knew that. All right? And that's the progression that we have in the total motion release training system. And it's stepping them through a little bit, a little bit, a little bit, a little bit at a time. And it's done in front of a tablet or a computer in which they're watching 2-3 minutes of a video of me, showing them what to do. I'm giving them instructions. Then they do it. And you finally now are sitting there as a therapist, as a coach. No longer do you have to keep spitting out the same thing over and over and over again. You get to help them when they really need help. You get to use the really cool stuff you went to school for to help and tweak them. And again, for us, we have 4 to 6 tables around with iPads on them. Patients are there. We've got a table here and we've got a table over there. And if somebody needs 5 minutes of a manual technique, we can pull them out and do it, send them back to getting back to their program. It really is. I know I'm tooting my own horn and stuff, but it's ingenious. It's a blast. It really has gotten so many therapists back to enjoying what they're doing. Some of them were about ready to leave the profession. They no longer are. I hope you'll take a look. Give me a call. Watch this another video if I have it up there yet. Just find out about this system, because you can have this for a very low monthly fee that actually, when you sell it to your patients, if you just sell a few of them, you're basically using the system for nothing per month, okay? So those of you who know total motion release, I hope you'll come on board, try this out. And those of you who don't yet, I hope I've intrigued you enough with all the videos online to say, you know what, this may be something I want to bring to my clinic. And the reason I ask you and I tell you this now is because there's only going to be a certain number that I'm going to offer these. I only want to work with maybe 200 people, 200 clinics, all right? And then I want to keep you and help you guys succeed. All right, that's like 4 per state. I want to help you guys succeed. All right, so again, it's what my passion is. I love the fact of trying to get patients better and better and better. And again, I hope you'll join me finding out more about the TMR system.